Hey, welcome back to Coast Live. February is American Heart Month, and all month long, Coast Live has been bringing you stories and interviews to raise awareness about heart health. And today, we're tackling the topic of COVID-19 and its potential effects on the heart. Joining me now is Dr. Mark Rosenberg. He's a clinical cardiologist with Secours, a cardiovascular specialist. Doctor, thank you for joining us today on the show.
You're welcome. Glad to be here.
Yes, sir. So, my first question. What if I'm in an emergency situation? I'm having heart attack symptoms like right now, but I'm scared about going to the emergency room because presumably it's going to be filled with a lot of people who have COVID-19. Is that something that I should still be worried about at this point?
Not at this point. Even during the height of the pandemic, we would still recommend going to the emergency room if you're having typical chest pain, shortness of breath, getting sweaty, just not feeling right. The first year of the pandemic, which was 2020, we saw that 40 to 50% of our visits for heart attacks were down all across the country. And during that same time frame, people tended to die at higher rates because they weren't getting to the hospital. When you have a heart attack, you need to call 911 and get to the emergency room as quickly as possible.
Okay, so my next question. I'm an individual with heart disease. I have HCM. I actually have an internal defibrillator. Does that put me at higher risk for contracting COVID-19? Or if I do get it, does it put me at risk for getting very sick from it as opposed to being asymptomatic or having mild symptoms?
You're probably not at high risk to contract it, but definitely if you were to get a case, people with underlying heart disease, like yourself with hypertrophic cardiomyopathy, would tend to get worse symptoms. The biggest ones we see is coronary artery disease, high blood pressure, diabetes. They tend to get the worst of the COVID infections. But you're not really at any increased risk of contracting if you have the heart problems.
So there's a lot of misinformation about COVID-19 going around right now. I want to clear the air about one thing in specifics. Is it true that one of the long-term side effects of COVID-19 could include heart damage, leaving you with a heart condition after you get COVID-19?
We've seen very few cases of that. We call that myocarditis, where they end up getting a weak heart muscle due to a COVID infection. But in our practice here in Hampton Road, we've probably only seen 1 or 2 cases of that. So it's still very rare. The vast majority of patients who get sick in the hospital and then end up with a heart condition, it tends to get better with time. So fortunately, we haven't seen any serious long-term complications with COVID. It's more of a minor stuff we're seeing. People have persistent heart palpitations. I've had patients that have dizziness, but most of those seem to improve with time.
So, Dr. Rosenberg, why, when we know that COVID-19 is a respiratory illness, how does it tie in with my cardiovascular system?
There's two mechanisms that we've identified. One is you get these microemboli, which tends to increase clotting in the bloodstream, and so it can lead to increased chance of heart attacks and strokes. We definitely see that with severe COVID. And then the second postulated mechanism is more of an inflammatory or autoimmune mediated thing that attacks the heart muscle. It's not the virus itself, but more of the immune system attacking the heart muscle. That's much less rare. So fortunately, we haven't seen too much of that, but there are cases of myocarditis out there.
So I want to ask, you guys have a special offer right now at Secours where you're trying to encourage people to come in and get a heart scan. Can you tell me the details about that?
Sure. It's a non-contrast, meaning there's no IV dye used scan from here to your diaphragm. It looks for calcium buildup in your heart arteries. And we know from years of research that the more calcium you have in your arteries, the higher risk you are of having a heart attack or dying from a cardiovascular cause. So what we'd like to do is try to catch disease early. And so the patients I like to order this test on are people between the age of maybe 45 and 65 who don't yet know they have heart disease, but we're able to catch it early and do interventions like put them on medications, change their diet, and get them exercising to prevent future heart disease. And during Heart Month, we do run a special to try to get that scan done for most of these folks.
Yes, sir. It's so important. Dr. Rosenberg from Secours, thank you so much for joining us today.